Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Little news, the biggest news in the state of Rhode Island, not the PC Friars, not the Bryant Bulldogs playing in the NCAA tournament, but it is the new license plate. 5 finalists are up. We've got all angles of it, and we've got to look at all the license plates over the years, going all the way back to the 30s. Take a look at that. But most importantly, let's go to Dr. McDonald. He's the acting director of the Department of Health. Dr. McDonald, thanks so much for joining us.
Well, Josh, thanks so much for having me. It's great to hang out with you today. It's fun to see you.
Great. Listen, we appreciate you taking the time. Rhode Island has done a remarkable job over almost exactly a year, going from the least vaccinated per adult population to the most vaccinated state in the country. How did we do that, and what's the implications of that where we are today in our transition in this pandemic?
Yeah, Josh, I think we did that together. It's not just all of government, it's all of Rhode Island. I'm very cognizant. There's a lot of public health ambassadors out there, people watching us right now who, quite frankly, have encouraged their friends to get vaccinated, or quite frankly, just use their voice to get people vaccinated. So it's not just Department of Health, it's not just whole of government, it's whole of Rhode Island. And I think it really underscores a point. People are understanding that this is what we can do. There may be certain times during the pandemic where we all felt like we couldn't do anything, but this is what we can do. And, when I look at where we are right now, look, yes, the pandemic's definitely improving. We're definitely heading in the right direction. We're in low, and that's great. But the bottom line, with 39% of my state boosted, I have cause for concern. And the reason I have cause for concern is there's a future out there. And, maybe people don't know what it is. I don't either. But, the future looks better if I have more people boosted. And so there's a caution right now. It's like there was never resting on laurels anywhere in the state ever. But we have a risk that we have to look at for our future. And if we're not, sufficiently boosted, our risk is magnified. And that's something we can all take control over, and we can all solve that.
Dr. McDonald, if there's one thing we've learned over the past 24 months and 2 weeks exactly since the first case was identified here in Rhode Island, is this coronavirus decides what it's going to do. We really don't have a lot of impact on that decision making, other than to react and try and protect ourselves. At 39% booster shots, I don't really understand it. Listen, I couldn't wait to get vaccinated. I couldn't wait to get my second shot, and the minute I became eligible, I wanted to get that booster shot. If you've already gotten the first 2 shots, why wouldn't you get the booster shot?
Yeah, and I think that's a really great point. I think therein lies complete the mission, my friend. Just get the booster and get protected. Because one of the things we know is, by the way, almost all of our vaccines need boosters. There's nothing unusual about requiring a booster. I think one of the things that was a little unfortunate in the beginning is, and I don't want to play hindsight 2020, but the reality of it is, it probably wasn't the right term nationally or globally to say to people, 2 shots and you're fully vaccinated. In retrospect, we should have used the terms we use for every other vaccine, which is said 2 shots and you're currently up to date. Because every vaccine has boosters. It's just the way it is. And it really gets to that issue of I think people have this false sense of security. And I think right now, people have a false sense of security that, hey, I'm okay. But the bottom line is, we know you really need to be boosted. And I want to give you a number. And I know it's not always, people don't always like numbers. But, we know when we look at our unvaccinated population compared to our boosted population, if you're unvaccinated, you're 55 times more likely to be hospitalized with COVID than someone who's boosted. Now, I said 55. I mean, in public health, we don't usually give the number 55. It's just not a public health number. It's a speed limit, but it's not a public health number. But you're 55 times more likely to be admitted to a hospital with COVID than if you're boosted. And to me, that's like red lights flashing, warning sign. What are we doing? Toto's not in Kansas anymore. We need to get back to what reality is. And our reality is we need to get boosted. And if you're someone who's gotten the first 2, it's like, I'm not sure what your obstacle is. Quite frankly, you've done the hard part. Let's just get that booster and get it done.
Is it procrastination? Is it that we're getting into a sense of, I'm going to call it false security, because we just don't know? Listen, there's enough data being generated around the country, and we'll talk about the subvariants in a minute, that there's enough potential threats that we run the risk of actually helping fuel a threat take greater hold and have more impact in the future. Is that part of this?
It is part of it. And the concept you're bringing now, which I think is really important, is Why do we get variants? And here's an important concept. The reason we get variants is the virus is still replicating. There's a fact that every virologist agrees upon is once the virus starts replicating, there will not be variants. The best way to get the virus stop replicating is to have people stop getting infected. That's a local problem, a regional problem, a national problem, but also a global problem. So there's a lot going on in the world right now, but it really gets to that issue is like, what can I do to help solve the problem? And this is where, if it is procrastination on someone's part, you can solve that today by going to a pharmacy and getting your vaccine. If it's something where you're unsure, you talk to your doctor. Your doctor is not confused about the vaccine. If you're someone who says, I want more time, it's like, look, I'm not sure what more time you need. There's been a lot of time. We're talking about 4 billion doses of vaccine given. We're rivaling McDonald's when it comes to hamburgers at this point. So we need people to just say, look, what's holding me up,
And far healthier than McDonald's.
Let's just so. Right.
Let's just go to reality, though. If I got my 2 shots last March, right, 1 year into the pandemic, 1 year ago, I was protected to 93 or 94%. That's waned down to, what's my protection level, 14, 12%? I need a booster.
Low. Yeah, it's very low. You need a booster. And it's like, and I think part of this for people is it's confusing. Like, in other words, if you get the Pfizer vaccine, your 3rd dose is due at 5 months. If you get the Moderna, it's due at 6 months. And people are saying like, I just can't keep track of this stuff. And it's like, I get it. But the bottom line is, think to yourself and say, look, if it's been long enough that I can't remember, you probably need a booster, so go get it done.
Dr. McDonald, let's talk a little bit about some of the complexities of we feel good, it's getting nice out. We know when it's nice out, generally we don't have the virus at the same level that we did previously, at least based on its behavior over the last 2 years. But there is some little bit of concern. I think people are flagging over in Europe, where it always seem to spark first. Whatever happens in Europe, we seem to get hit on the East Coast about 6 weeks later. And there's a subvariant of Omicron that looks like a hybrid of Delta and Omicron together. The initial reports are just beginning to be, and the initial analysis are just being put together. But when you see and read that in the journals, whether it's Lancet or New England Journal or whomever, what's your worry, and when do you need to start to speak out and sort of hit the let's pay attention button and go over and talk to the governor?
Yeah, and I think therein lies the issue, is there's nothing surprising about a new variant. Now, keep in mind, the Delta Omicron is not a surprise at all. There's not that many cases, but quite frankly, the good news on that is we're finding it, we're paying attention to it. And this is an important difference. Like, one of the things that's true in 2022 that was not true over 2 years ago is we're looking for variants. So we're doing case finding for variants. That's really important. That's the good news. That's the Star Trek medicine that kind of excites me. We're looking for variants. What I worry about is, hey, does it escape the vaccine? In other words, if the vaccine's still good, not so worried. What about treatment? Does the treatment still work? If the treatment's still good, I'm not so worried. And I think therein lies back to, what can you do? What you can do is make sure you're boosted. And you might be like, why does he keep asking me to get boosted? It's because I think repetition helps, my friends. And it's one of those things where it's like, I'm your doctor. I'm the state's doctor. I care about you as a person. I don't want you in one of my hospitals. I want you healthy. Because if you're healthy, you get to enjoy the 3 best reasons to live in Rhode Island, which are June, July, and August. And they are coming, my friends, sooner than you can imagine they're coming.
Dr. McDonald, when you were in med school, you're a pediatrician by training, am I correct?
I'm boarded in pediatrics, but also preventive medicine, so I actually do know what I'm doing here. In other words, I'm professionally trained in public health. I'm not making this up.
But when you were sitting in med school thinking about taking care of 6 months old, did you ever think you'd be at the point person for state on a pandemic that has led to over 3,400 deaths, over 200,000 cases? I mean, monumental impact, people's long-term health. We probably get about, if you take 10% who are long haulers, we've got, 20,000 people are going to be dealing with health effects of this pandemic for certainly months, if not years to come.
Yeah, Josh, when I was in medical school, what I was really worried about was learning everything I need to do so I wouldn't hurt anybody and would definitely help people. Like, I just want to bring back to medical school. Very, very time intensive, but it's like, No, never in my wildest imaginations did I ever think we were going to ever have anything like this. And it's one of those things, but when I think about this pandemic, it's funny. It's unprecedented how unprecedented the word is. In other words, we won't even use the word unprecedented anymore because this whole thing is so unprecedented. And one of the things that just stuns me about the whole pandemic a little bit is how big a magnifying glass it is and how it's interesting. Like, I live in a world where the movie on Netflix, Don't Look Up, became popular because everybody said, oh my gosh, I resonate that. That was the pandemic we just lived through. And I don't know that you expected a Netflix recommendation today about Don't Look Up, but it's funny. And sometimes humor is one of the best medicines out there.
Dr. McDonald, obviously, I don't want to say the states are flying alone, but there's been so much criticism and rightful criticism of the CDC and some of the decision making it has made over the past 2 years. How does the CDC rebuild trust with the public? Seems to have made so many significant science-based errors. We can check them off one at a time, but they really, and I'll tell you a comment. Jennifer Lawless, who's the chair of the political science department at the University of Virginia, is on with us every Thursday. And she said, and listen, this is a liberal professor at the University of Virginia, a big Biden supporter. She ran for Congress as a Democrat. She said, maybe we need to rethink the CDC. Maybe they're good for, lettuce getting infected. But when you're looking at such a significant event, they're just not built for this type of structure.
Yeah, it's interesting. I'll throw this out to you. One of the grants that I'm excited about for our future, it's coming from the CDC for every state. And this is where I think, to answer your question, what do we do about rebuilding trust? Like, there's grants coming out for strengthening the public health workforce. And one of the things I think we've learned as a nation is, public health wasn't sexy. And people don't go into public health for fame or fortune. But, we need to strengthen the public health workforce. It needs to be more relevant. So, like, one of the things I'm optimistic about is there's a national grant that every state's going to get a lot of money for to strengthen our public health workforce. And I think therein lies optimism for our future. It's been a challenge to be in public health the last 2 years. I don't know if you've noticed this, but it's been really stressful to be in public health. And a lot of us are still here and still going strong. We're rolling, you know what I mean? But it's like, if we can train more people in public health and, offer more support for the people in public health, I think it rebuilds what we need, not just nationally, but it also supports what we want locally. Because quite frankly, public health is local. And one of the things about the CDC, they give you recommendations for the whole country, everything from the Northern Marianas to Northern Maine. And quite frankly, my job is Rhode Island. That's what I care about deeply, because we have an ocean. We have other things going on here, nice food, restaurants, a lot going on, tourist industry. Rhode Island's what I'm concerned about, because I know the nooks and crannies of my state. And that's where I think making sure local health departments are strong, that's really going to help all of us in the long run. And that'll be true for every jurisdiction in the United States.
It's an interesting thing. Governor McKee took a very local approach, right? He partnered with the cities and towns. And in the olden days, cities and towns, still in Massachusetts they do, they have local health departments. The city of Worcester has a doctor that's the health director for the city of Worcester. Do we need to sort of follow that McKee model a little bit, where we're constantly engaging the cities and towns, and the mayors understand it, and the head of the Elderly Housing Authority understands it in a much deeper way than we did previously?
Oh, I think Governor McKee's right on that. We need definitely involve local people. Like, I'm on a call with municipal leaders every week, and he's been great about just getting local leaders involved, and one feel very much connected to the pandemic. I don't know that we need local health departments, though, because we're a small state. 1.1 million from public health, it's a manageable number. And so, what I think is more useful for us is make sure the Rhode Island Department of Health is strong, as well as our partners. And I think that's better. What that looks like in the future, that's something that I think is kind of fun to think about. And I'm not sure I know, quite frankly. Right now, what I'm trying to do with the Department of Health and my role as interim director is make sure people get the rest they need. Because I've told everybody here, my goodness, my friends, this has been an amazing 2 years here, where 5 o'clock now needs to mean something. Saturday and Sunday, I don't want them working anymore. And by the way, when there's holidays coming, I want them off. And one of the things that sounds kind of odd, but I'm the guy leading a state agency tell people, like, you're working too much. And I know people like, I've never heard this before, but it's like, for the last 2 years, the people who are in this building have just been working too much. And I'm telling them that's not healthy. What's healthy is balance. And what's healthy is making sure we actually are healthy workers so we can offer the best advice. And people are following my lead on that, and I'm excited to see that.
Dr. McDonald, let's just go back and round up. Hospitalizations are down, transmission rates down. test percentage positive. Self-selecting group around 600-700 people getting testing positive every day. If you work that out, but it's still at about 3%. So we've still got a fair amount of virus going on in the state of Rhode Island. Reiterate this importance of getting boosted from a standpoint just simply of public health. Why is it important that Rhode Islanders move that 39% who are now boosted to match up with that 90% who got the first 2 vaccination shots?
Yeah, and I think if we just remember Martin Luther King Day weekend in Rhode Island, we get the public health message. We overwhelmed our hospitals in Rhode Island Martin Luther King Day weekend. And that's when this thing peaked for us here. And it was an avoidable trauma, not just to our people, but to the healthcare workers and really the whole state. It was an avoidable trauma. And it really gets back to the issue is, what could we have done to prevent it? And it's like, we had plenty of vaccine. We have plenty of treatment now, but this really gets to like, when I say self-selected for the disease, hey, it's getting like every other disease. We all self-select. We all go to the doctor when we're sick. The key thing with COVID is it's preventable. We have a good vaccine, but you've really got to be up to date with your doses. And this is really one of those things where if there's personal inertia, something getting in your way, figure it out and solve it. And by the way, you probably need to be getting your information if you're confused from somewhere, but it better be your doctor and the health department, because if you're confused about it, your health department and your doctor, they know what's going on. They're happy to tell you. They're not confused ever. And that's where people need to go. Go for reliable information for people you know and people you trust.
Dr. McDonald, Rhode Island Department of Health, you're the acting director. I want to thank you so much for taking the time for joining us today. For everybody else, stay tuned. A lot going on here in Rhode Island all day. Kate Nagel is live down in Newport with a major announcement by Cox. She's with the governor and Joe Saccarci and Dominic Ruggiero. You can catch that as well. It is a busy day across Rhode Island. Everybody stay safe. If you haven't gotten your booster shot, run, don't walk. It's free, it's easy. Even I could get it done. Thanks, everybody. Stay safe.